The treatment options for closing a gap but for teeth is you pretty much have three options. Either you can do a partial, which is the simplest thing you can do, and it's really just one little piece of tooth if you're missing one, or two teeth, whatever it is, but it is something that you have to take in and out. So that's one option. The most cost-effective option is that one. The next option would be doing a bridge. So a bridge is a little more fixed. You don't have to take it in and out. Only downside to it is you're using the two teeth on either side as posts. So here's your post, and then in the middle is that fake tooth. And only downside, again, like I said, everything is connected. So you can't really floss like you do with your other teeth. You have to floss under it. So you just have to be really careful and really diligent in keeping it clean. Because if anything happens to those two posts, then you're gonna have to replace that whole bridge. The third option would be to doing an implant. So an implant is probably the best option because you're not messing with the two teeth on either side. Only downside to it is it takes time. So once the actual post, so the implant goes into the bone, you have to wait for it to heal, and it usually takes around 4 to 6 months. And then after that is when you can actually get the cap on top. So you treat it like any other tooth. You can brush it, floss it. Only downside, like I said, it just takes time. But in the future, if anything happens to it, you are literally just messing with that one spot and not the other two spots. The braces and clear aligners. So the differences are clear aligners are so much more people friendly. You could take them out whenever you're brushing, whenever you're eating. A lot easier to take care of your teeth in that, that sense. So you're not having to deal with all the brackets and wires like traditional braces. Yes, you could definitely close a gap using both. But yeah, it's really just more convenient. Only downside to the clear aligners is you do have to remember to put them in. You have to remember to take them out whenever you are brushing, whenever you are eating. And then just making sure you stay on schedule with all of the like the trays that you have. With braces and clear aligners, the treatment time is usually around the same. You probably go quicker with clear aligners just because you can really see like the path that you're going down. Braces you tweak as you go. So say if like you come in and you get your braces on, next time you come in, you can evaluate it then and then make sure it's going, in the right direction. You tweak it as you go. Whereas clear aligners, you see the end product right from the beginning. And, if you come in like the next visit and we see that, something's not lining up, that's when we can really make change the treatment then instead of waiting till the very end. For smaller gaps, yes, there are options available. You could do something as easy as doing a filling. So if it's very tiny, you're like, I don't want to go through the whole process of, doing braces and closing it or even clear aligners and closing that gap. You can do composite fillings, so you could do tooth-colored fillings on that space. Yes, your tooth might look a little wider, but it will fill that gap in. You could also do veneers, so you could, use two teeth instead of one tooth and just kind of make everything even as it is.